Not every person who experiences trauma will develop post-traumatic stress disorder. Why? There are a lot of factors that go into that, including neuroplasticity of the brain, which can heal after traumatic influences. It doesn't have to be a permanent state. No mental condition has to be permanent. It can be chronic, but mental conditions are treatable and can be managed with coping skills, with supportive relationships, with community support. Sometimes just being able to talk about the trauma helps people function better in their daily life. So what actually happens to someone to be diagnosed with post-traumatic stress disorder? There's exposure to actual or threatened death, serious injury or violence of yourself, of someone close to you, being a witness to that sort of violence or graphic situation can cause symptoms of PTSD. In order to be diagnosed, you have to have some sort of reintrusion of the trauma. That can be flashbacks, that can be nightmares, that can be intrusive thoughts, and it's influencing your behavior in a way that is causing trouble for you. This includes avoidance of things that remind you of the event, not going to places where it happened, not seeing people that remind you of it, avoiding people, avoiding talking about it, avoiding thinking about it. Some people even black out parts of those memories. We see negative changes in mood and in thoughts. We see persistent and exaggerated negative patterns of how someone talks about themselves and how someone thinks. Negative changes, when we're talking about negative in mental health, that also means lack of. Negative symptoms of psychosis. One example of that is not being able to use facial expressions or use tone of voice in a full way. So this sort of negative symptom is the same thing. One negative symptom we see is an inability to remember the event. Even if someone tries, they struggle to remember the details of the trauma, or maybe they don't want to talk about it. Negative beliefs about the self. I did something to deserve this. I'm responsible. I shouldn't have done this. I am bad. This happened to me because I am bad. I deserve this to happen to me. Low mood. Even in positive situations, even in areas where they might have been happy before, like celebrating with their children, like going out on a date, like spending time with their friends, getting a promotion at work, they feel numbed and they are having a hard time experiencing those positive emotions, even when a situation would conjure up those positive feelings. Also see negative mood, consistent low mood, unrelated to external events, numbness, sadness, depression, apathy, loss of motivation, loss of interest, regardless of the external environment. Reduced engagement with the environment. Some people become agoraphobic, some people become very lonely, some people stop going to work, stop going to school, stop reaching out to their friends, stop answering their phones, stop going to the doctor.